Well, I think there's a lot of problems with the Affordable Care Act. I've got some issues with the Affordable Care Act. We need. Well, I think if you look at some of the funding mechanisms through taxes on health insurance plans that are deemed to be true generous, I think that's the wrong approach. And I think we're seeing things as we continue into implementation that may not be working the way that they were intended. And
scrap it and start over?
No. We cannot go back to a time where insurance companies were allowed to drop people when they got sick, to discriminate against the 128 million Americans who have pre-existing conditions. This is very important to me and my family. I would not have health insurance for my family or for my son who has a serious pre-existing condition without the new health care law. So we need to do better. We need people who honestly believe in making policy work and making sure that people get health care that they need and deserve. But you have to have people who believe in actually making that happen and making it work.
Tell us a little bit more about your family's experience with the healthcare system, and especially this major change that you had. You mentioned your son Jack's diagnosis. Was it in November?
Yeah.
With a serious genetic degenerative disease, correct? So how has that affected your family and how you feel about healthcare in the country?
Well, every family essentially has someone who has a serious health condition or concern over time. Obviously, cancer. There's a lot of diseases that affect families, and so that's how we need to talk about it. We need to talk about how this actually affects people. This is where public policy intersects people's lives. I'm right now, I don't have an employer-based health plan, so having a son who has a serious condition that requires significant medical care that could save his life at any given time is very important. People need to be able to get health insurance. And in the old system, prior to the new health care law, that wasn't the case. I don't know if I could get health insurance. I don't know if I could get affordable health insurance because there would be the discrimination there against the pre-existing condition.
And if you did not have health insurance, if you didn't have that option, what would you have to do? What would you be doing?
I would probably be bankrupt, frankly. Even with health insurance, and I sat down at the end of the year to look over my financial situation. With health insurance, had spent nearly $10,000 out of pocket for health care on top of insurance premiums. And that was, a time when I had what I believed to be good health insurance.
And this is expensive program. Yeah. It's not only expensive for people who need serious health care, but it's also expensive for the taxpayers. You said that the taxes on Cadillac plans is not the way to go. How should we be looking to pay for this going forward?
Well, I think we've got some good approaches. We need, everyone to be, healthcare is important to everyone. And so there needs to be investment, by folks across the board. So I think there's a lot of options on the table, but we need people to come together. Right now, there's
so you don't
no
have
discussion.
A specific
well,
idea?
I think there's several ideas out there, but I don't want to get into specifics because right now we don't have anyone sitting down and figuring out a way to compromise and actually make that happen. We have people like my opponent who are saying we need to repeal everything and go back to the old days where all these things are not covered.